righty, so let's go ahead and get started. I'm going to share my screen. And if you guys don't mind, at least one person, Nelly, can you give me a thumbs up if you can see my screen? Perfect, thank you. That helps me a lot. Thank you, Natalie, appreciate that. All righty, so as I mentioned today, this is the retirement planning workshop. So that means either you're interested in knowing about what is to come in terms of if you're thinking of retiring retiring in the near future, or maybe you just want to know the information. So this is a really good workshop to come to. So what we're going to do is what we'll cover is really some important age benchmarks. I like to make sure that there is not confusion because there are two ages, 65 and 67, that we talk about, and a lot of times people get those two confused. And so I want to make sure that you guys have clarity right out of the gate about what you need to be thinking about for these two different age benchmarks, okay? We'll talk about eligibility. We'll talk about contributions / premiums, what you need to know about that. We won't be looking at rates per se, but we'll be talking a little bit about how the district helps with that in retirement. We'll go over benefits. And then I'm going to go over some very, very, very basic level information on Medicare, not hopping into a lot of details because guess what? We have 2 Medicare 101 workshops this year. So I don't want to spend too much time on it, but I do want to give you a basic level so you understand some of the information we'll be talking about. And as I mentioned before, we'll open up the end for questions. Okay. All righty. So I started off by saying there are 2 important age benchmarks. You will hear 65 and 67, and I want to make sure that with those 2 age benchmarks, you don't mix up which is important for what, okay? When we talk about the age 65, the age 65 really refers to something that everyone, whether you are a Montebello Unified School District employee or not, is going to need to be aware of. That is approaching retirement age or retirement in terms of applying for Medicare. Now, whether you apply for Medicare at the age of 65 or not is really going to be dependent on whether or not you're actually going to be retiring or if you're going to keep working. But the important thing you need to understand about the age of 65 is that is the age for which you are eligible to apply for Medicare. And if you are retired, when you need to apply for Medicare. That is important because applying for Medicare is going to ensure that you are able to take advantage of your CalPERS retirement health benefits. So the age of 65, keep in your mind, that marks applying for Medicare, okay? It also marks the time frame in which if you apply for Medicare and you are retired, the choices that you have available to you as a retired member, your medical plans will be a little different than what you take advantage of now as a working employee. So that's one thing I want you to remember about, or 2 things I want you to remember about the age of 65. Separate from that is the age of 67. And it's important and specific to you all as Montebello Unified School District employees. That is the age for which the retirement health benefits where the district contributes on your behalf, that's when that stops at the age of 67. So just keep that in mind. I'm going to circle back to this because now I want to hop into a little bit more information about that so that you know what I mean by that, okay? All right, so let's talk about eligibility. So as a retiree, to qualify for your retirement health benefits through Montebello Unified School District, you have to have at least 15 years of service with the district and be at least 55 years of age, okay? So those are 2 important things that you have to have in order to qualify for what we're about to talk about as retirement health benefits, okay? So there's a little bit of a checklist before we go into kind of like how they work. I want to make sure you understand Number one, you know who's eligible. We just talked about that. Got to have worked for 15 years and be 55 years of age. The second thing is, what's the checklist of essentials that you need to make sure you do once you have decided you're going to go ahead and retire? And just so you know, this information is actually going to be provided to you by the benefits department. They usually have like a checklist they give you. So let's just say you're ready to go in terms of retiring. You typically want to meet with your PERS counselor. That's really an important part to determine your retirement date and find out exactly how much you expect to receive from a retirement standpoint. And PERS meaning CalPERS counselor, okay? So, and there'll be information on who to contact to make an appointment with your PERS counselor. Once you make your appointment with your PERS counselor, you decide on what your date's going to be, find out how much you're going to expect to receive. You want to contact Human Resources, your classified personnel, and let them know your retirement date as soon as you've determined it, because that sets forth the whole process of things that they have you do. Human Resources may have you do some steps, but from a benefit standpoint, once you have notified them, then you want to also make sure that if you will be 65 at the time of retirement, you want to make sure you visit the Social Security office and apply for Medicare. You want to do that about, I say to be on the safe side, about 3 months, not 3 minutes, 3 months before you turn 65, because that gives you a little bit of margin in case you make your appointment, you forget something, you have questions, or maybe, there's a little bit of delay for one reason or another. That gives you time so that by the time you hit 65, everything is already in place and already in process. So when you contact Social Security, the Social Security office, they will walk you through the steps of applying for Social Security and applying for Medicare, Medicare Part A and Part B, and they will determine your eligibility. And if you're eligible, everything's great. They will submit that information to CalPERS. If you're ineligible for Medicare, then you'll need to request a letter from Social Security, and they will provide that to CalPERS. Okay. And once you've done those first 3 steps, then you want to go ahead and visit the benefits office, and they'll give you information on rates and continuation of benefits, which is what we're going to talk about today, but it's typically a packet. Okay. So these are the general steps you want to take. Meet with your PERS counselor, determine your rate, your retirement date, and how much you expect to receive. Let HR know, go to the Social Security Administration office, apply for Medicare, and then visit your benefits office. Okay. Those are the 4 steps that you really want to start off with. Okay. So let's talk about, once you do all of that, how does this work? Okay. So in terms of how the contributions work, after retirement, your health plans. So let's just say right now you have Anthem Blue Cross. Your Anthem Blue Cross, I know that normally you make your elections and everything, you change, if you need to, how many dependents, what tier, what plan. Right now, I know you work through the benefits department to do that. However, that's not how it will work when you're retired. And as an active employee, everything is really done from a payroll deduction if you choose a plan that requires one. Most of the plans you guys have do not at this point. But when you retire, all of that you used to do through the benefits department now is going to be directed to CalPERS. Okay. And any premiums for whatever the cost of whichever plan you decide to go with, those will be deducted from your CalPERS retirement check. Okay. Now I'm going to talk to you in a minute, just kind of how that's going to work with the districts. Just give me a second. So you want to make sure that the banking information on file that you guys have on file is a current one. So that it is one that is where you want your reimbursements to come from or come to. So how this will work is, let's just say you decide in retirement you are going to be Kaiser Permanente, just for example's sake. And since you will no longer be handling any of that through the district, it will go through CalPERS. And let's just say that you have a premium for the cost of your CalPERS health plan. So what will happen is for your premium for your health plan, it will be deducted from your CalPERS account, and it will go through whatever account you have set up on CalPERS. And then the district will actually reimburse you for a specific amount, and the amount is established each year. A letter is sent out to all retirees, so you know this year the maximum amount that the district will reimburse towards the cost of health premiums is X amount. And if you're not on mute, go ahead and put yourself on mute because we can hear you. So let me go ahead and just mute them anyway. So what happens is you have your premium that is due for your health plan, that's deducted, and then the district reimburses you for a specific amount up to whatever the maximum amount is, okay? Now, just know if you are already 67 when you get ready to retire, you won't get this premium reimbursement, okay? So I mentioned before, I want to go back so you guys can remember when I talked about here, 67. When you hit 67, the district is no longer doing the premium reimbursement. So just remember that, okay? All right, so let's talk a little bit about what the premiums are, kind of like how they kind of look in terms of for the current year. So I mentioned before, 55 up to age 67, medical insurance reimbursements up until the end of the month that you turn 67, and then beyond that, you won't be reimbursed. Now, depending on your bargaining unit and depending on your FTE status, the amount may be different. For the 2024 year, these are the amounts, the maximum amount that the district will reimburse you up to for the cost of the health insurance premiums. So you'll see here, AMSA, it's $1,692 for 7 to 8 hour CSCA employee, which is 100%, $1,466, 3/4 time, $1,100, and half time, $733. Something very important you want to know is that based off of the plan that you choose, you could potentially end up with an out-of-pocket. So if you choose a plan that exceeds whatever the maximum contribution, and I say contribution by what I mean by that, that is the amount that the district will reimburse you up towards the cost of your health insurance when you retire. So if your amount of your plan exceeds, let's just say you are a 100 FTE CSEA employee and your max contribution amount is $1,466, but you choose a plan that is $1,500. And I'm not saying that's what it is, but just for example's sake, you choose a plan that is $1,500, then you would end up having to pay that difference of 40 some odd dollars, okay? Because the max they will contribute towards the cost of your health insurance premium is, you know, whatever their set amount is each year. They don't send that information out last minute. So this amount that you see here was what was established in 2023, and a letter and notice was sent out to retirees in the fall. So several months before we move into the new year, you will all be aware of whatever that amount is when you retire, okay?
I'm sorry, Asia.
Yes.
We don't send letters out to the retirees any longer. We just post it on the district website.
Oh, okay, perfect. Thank you for clarifying that.
And we try and do it obviously during open enrollment so that you have the opportunity to check and make sure that whatever plan you're on is going to keep you under the cap if that's what you're trying to do.
Perfect. Thank you for mentioning that, Laura. So this is a good point for me to do a quick check-in and see if to this point, if there are any questions on what I have covered so far.
I have a question. Let's say you're a 6-hour employee and you know, you qualify. So it says you're gonna get 75%, right?
So no, so 75% refers to the FTE status. So if you're anywhere between 5 hour and 6.5 hour employee, you are considered 3/4 time or 75% FTE status.
Okay. So like, let's say because I'm trying to do 40 years. So if I do 40 years, will it go up to 100% or no? It'll just be 75%.
So this percentage doesn't refer to the amount of your contribution. This refers to your FTE status. So in your 40th year, in your 7 to 8 hour, then, and you're classified as 7 to 8 hours, then you would be considered full-time. So then your maximum contribution amount would be 1,466.
Right. I understand that part. I'm probably not getting the whole thing of it because I am a 6-hour aide.
Okay.
So
Then
that's
yours,
why I'm like thinking that the max I'm gonna get is 75%. It doesn't matter if I do the 40 years or not.
when you retire, if you're still in that bucket of 3/4 timer. So if you're working between 5 and 6.5 hours, the whole time when you get ready to retire, then your max contribution amount would be whatever is established for people who are working, 75% FTE.
Okay.
Does
Alrighty.
that
Okay.
does that make sense? I don't want to leave your question without you getting an answer
I
that you
think
understand.
I think that I would just have to go, like you said, I would have to go in and make an appointment and talk to the counselor to see really like what it is I'm gonna get.
Yes, so let me make sure I clarify that. So when I mentioned talk to the counselor. So your appointment with your PERS counselor is the appointment that you set with them to discuss your retirement. And just so you guys know, CalPERS handles health insurance, but they also handle retirement for public employees. So they will kind of sit down and talk to you and ask you questions to help you decide when's going to be the appropriate time for you to retire and like what your pension would be, and have you set up all of your information for your CalPERS account. Now, when we're talking about like which one of these would be the amount that you would particularly get as a CSEA employee when you retire, you're going to really need to make sure that you understand how many hours you're retiring at. Are you retiring as full-time or 3/4 time, or are you retiring as half-time? Because that's going to depend on, that's going to what determines what your contribution is that the district is going to reimburse you at when you get ready to retire. So that's what I would encourage you to do, is when you're getting ready to retire, you understand what is your FTE status, because that is what this contribution column is referring to. So if you retire and you're on average 4.5 hours is what you work on, in terms of your employee status, your half timer, then the 733 is what you're going to get. Okay. So the question is
Excuse me, are you?
Yes, go ahead.
I'm sorry. So since I'm a 6-hour employee, this is Natalie, by the way, I can't get my camera to work properly. I would only get 1,100 a month. Is that what is that? Or is that my contribution?
That 1,100 a month is the amount that the district would reimburse you towards the cost of your health insurance premium. So let's just say, for example, Natalie, you chose, when you got ready to retire, you chose Kaiser Permanente as your health plan. Well, right now, if you have Kaiser Permanente, the district covers pretty much everything. You don't really see, any deductions or anything. But when you get ready to retire, CalPERS handles everything. So let's just say you have Kaiser Permanente, and for your plan, the monthly premium for you to have a health insurance plan is $500. I'm just making an example to explain it. But let's just say you have Kaiser Permanente, it's $500. Then what's going to happen is Kaiser, your CalPERS account is going to be charged the $500 for the Kaiser Permanente plan, and the district is going to reimburse you to that account $500. So it'll be like a wash
I see.
if you choose a plan that's under your max contribution amount. Now, if you choose a plan, let's just say you do Kaiser Permanente family plan and it happens to be $1,200, okay? They're going to charge you $1,200 and the district is going to reimburse you $1,100 if you're if you're in this 3/4 bucket, then, they'll reimburse you the $1,100 and you will have to pay just that $100 is what you won't be reimbursed, because it'll be $100 over what your contribution is. Does that make sense?
I think so. I haven't decided if I'm retiring yet or not, but that's just something that I'm looking into.
Okay.
I've been with the district also, I think, 40 years, so, but I don't know if I'm gonna continue another year. I haven't decided that yet.
Okay, well, please know that if you decide not to retire this year, these amounts may not apply. If you decide to, retire next year, just know that the amounts are updated each year, okay? So again, as
Right,
Laura
right.
mentioned, they posted on the actual benefits website, okay?
Okay,
Okay.
thank you.
No problem. So I want to, there's some questions in the, I'm going to answer a couple questions in the chat box. I'll go to Nora and then Nellie. Okay. So quick question here in the chat box. Someone mentioned, I want to clarify it. The question is non-trust certified certificated employees are on the call. Also, will that information be provided for this group that is current, that is not on this slide? So good question. I will make sure I provide that information. So I'll get that. I want to say it's the same as AMSA 1,692.
Yeah, it is the same.
Okay, so for the person who posted the question, the one for AMSA is 1,692. Okay. And for the other question, there was a question on what does FTE stand for? Full-time employee. It basically stands for like what your status is. Are you a full 8-hour employee? Are you a 3/4 time employee? Are you a part-time employee? That's what that stands for. And my apologies if these percentages confused anyone. 100% refers to you're an employee who it works typically daily 7 to 8 hours. If for 3/4 time, that means or 75%, that means you're an employee who works typically your day is 5 to 6.5 hours. And then when you see that 50%, that means that typically you're an employee who works 4 to 4.5 hours. That's what those percentages are referring to. So I apologize if that created any confusion. Okay. So Nora, we'll go from Nora to Nellie, and then we will move on. And if you have other questions, just hang tight. I am going to get to them. So Nora, what's your question?
My question is, you said that CalPERS will deduct the amount that we're covered on, depending on our coverage percentage.
Mm-hmm.
When the district reimburses us, is it that same month or at the end of the year? At what point do you get reimbursed?
I will let my experience in talking to retirees is that it's pretty seamless. There's not like a lot of days in between or anything like that. It usually happens, almost like you don't really know that it happens. They usually happen right around the same time. But I don't know if Laura, you have any contribution on that any insight you might want to add.
Yeah, so we normally get the bill from CalPERS in the middle of the month. And we use that bill to reimburse you at the end of the month. So usually you'll see your deduction come out on your check that you get the last or first day of the month. And just about the same time, you'll see the reimbursement go into your account. Okay, it's always going to be a month behind, because we can't reimburse you until we see the bill, which means it's already been taken from you. But once we start reimbursing you, it'll be every month, and you'll see it every month.
Okay, thank you.
All right. And then, Nellie, what was your question? Is Nellie still on here? Oh, you're on mute, Nellie. Nellie, take yourself off mute.
She can't hear you. No, not me. It's Nellie.
Okay, Nellie, we'll come back to your, I haven't forgotten you, but we can't hear you. So I'll move back, but I'm gonna come back to your question, so don't forget it, okay? Oh, wait, looks like you got it unmuted. Go ahead.
Okay, good. I think my question has already been answered. So this contribution that you're talking about, that's done every month
Mm-hmm.
on a monthly basis?
Yes, yeah, when you retire, so that's a good,
Okay,
I'm glad you brought that point up. So right now, the way everything is deducted, you guys are tenthly, I know that as employees. When you retire, everything is done on a monthly basis. So
Okay.
yes, it will be monthly. Okay,
okay, thank you.
no problem.
Okay.
All right, quick question in the chat box real quick, because this is just reiterating something we mentioned before. So who and how do we pay when we go over? So how it works is if you choose whatever plan you choose, let's just say you are a classified employee who works between 5 and 6.5 hours, your max contribution would be $1,100. If you chose a plan that is $1,200, your CalPERS account will be billed $1,200, and then your reimbursement would come in and reimburse you $1,100. So it would all occur through your CalPERS account. Okay. So it would be CalPERS. Okay. So let's go ahead and move on, and we'll come back to some additional questions. I'll make sure I circle back and check in with you guys for any additional questions you guys have. So don't think I've forgotten about you, okay?
Asia, at the end, let me also talk about retirees whose retirement check does not cover.
Oh.
Yeah,
Sure,
Okay.
sure.
Thank you.
Okay, so real quick with the CalPERS premium, since we've been talking about premiums, one thing I want to make sure you guys understand is that your CalPERS retiree premiums for your health insurance plan, they're set based off of where you live. So what that's going to mean is if you live in Southern California versus out of the state, your premiums could be different. So just make sure that you understand, if you're planning to retire in a place other than Southern California, then your rates could be higher. And so I know I'll get the question, well, how do we know what the rates are? Well, I'm glad that you asked that question. Is the links for the rates and plans for CalPERS are released each year. They're typically right around open enrollment, the same time frame for which you guys make your elections. That information is released on the CalPERS webpage, and the rates are usually listed there. And I've included the link here. Even if you're not planning to retire this year, you can at least click on the link and you can kind of see what that information looks like. And always know, for all of you who are retiring, if you are trying to figure out which plan is going to be a better option for you and you kind of have some questions, you're always welcome to set up an appointment with me. I have done this with many of you as active employees, and I do talk to retirees to kind of help give a little bit of guidance around what are some things you want to make sure you factor in when you choose a plan, and understanding which plan is going to work out for you. So just know that if you click on this link and you see all these rates and you're like, okay, I don't know what I'm looking at here or how to choose, just know that you do have support, so I can help you decipher that. But I did include this link just so you could see where this information is housed whenever you start looking at retiring, and if where you're going to retire is going to be outside of where you currently are, then that's going to be some information you want to definitely look at.
That's also something that the benefits department can give you if Asia's not available. We do have access to all of those rates. So if when you come in and you see me, if you tell me that you're going to be retiring in a different county or different state altogether, I can get you the rates at that time, and you can take a look at them and decide, what the best choice is for you.
Awesome. Okay. Alrighty, so let's move on to some information. We kind of covered a little bit already right in the beginning, but I want to reiterate this again just so that it will avoid any delays in you getting the information you need. I want you to remember that as it pertains to your health insurance, once you retire, CalPERS becomes the health benefits officer over your medical benefits. Essentially, CalPERS is now your new Laura when you retire. May not be Laura, may not be as helpful as Laura, but hopefully they will. But that will be who you want to redirect all questions regarding policy selection, plan information, enrollment, eligibility, adding or deleting dependents. All of that when you retire is going to go directly through CalPERS. Okay. So just keep that in mind. Medical benefits under the age of 65. Remember I mentioned that 65 versus 67. I want you to just think just strictly about 65 now. And if we're talking about the age of 65, what that means is we're talking about things related to Medicare, okay? So we're talking about CalPERS plan options. So up to the age of 65, the plan options that are available to you under the age of 65 are the same as what you currently have access to now. So if you plan to retire before you turn 65, then you don't have to worry about unfamiliar plan options. Everything that is available to you now as an active employee, if you're under the age of 65 when you retire, it'll be the same plan options, okay? So no need to be concerned in terms of that. However, when you turn 65, I alluded to this right in the beginning of the presentation, your plan options are different because now you become Medicare eligible. And so you know, that is something that you want to make sure that you are paying attention to. Because if the plan that you are currently on as a person who is under 65 is not a plan that is available once you turn 65, you'll have to choose something different, okay? And each year, as Laura mentioned, you know, she has like the information in terms of like the rates based off of region. CalPERS also releases information on the plan options that are going to be available for those who are Medicare eligible. That means 65 and older, okay? But if you are not 65 when you retire, then, and you're happy with your plan, then you don't need to change doctors or plans or from one plan to the other. You can keep your same hospitals and all that. Everything will remain the same if you do not wish to change your plan and you're under the age of 65 when you retire. So it's just kind of continuous. But you just want to be keeping in mind that when you start to approach 65, there will be some changes, okay? So if you do not make any changes when you hit 65, and the plan that you have is not one that is Medicare eligible, you want to make sure you choose something. Otherwise, CalPERS will choose one for you, okay? So you just want to make sure that you keep that in mind. So for medical benefits for people who are over 65, since we've been talking about it. So I mentioned that CalPERS releases the plan options that are available when you're 65. What you're looking at here is the Medicare eligible plans for the plan year of January 2024 through December of 2024. So that means that this could be a little different in 2025. So that information is updated, like I said, every open enrollment period. But right now, as you guys can see, there's a pretty robust number of plans. And most of the plans that you see here, there is a comparable basic plan, kind of like what you guys currently have. There's like a matching Medicare plan for most of the plans currently. So there's no shortage of plan options for you in terms of when you transition from being under 65 to being 65 and older. So that's something you don't really necessarily have to worry about in terms of options. Because as you see, there's Anthem, Blue Cross, Blue Shield, Kaiser. But again, this changes each year. The information is provided during open enrollment the year before those changes will take place. And you can always visit the CalPERS website to see this information. One thing I do want to mention to you, since we did talk about retiring and potentially retiring in a different region than where you currently are, if that is you and you do plan on retiring outside of Southern California, say you decide to move to Northern California, there are certain plans that are available in Northern California that you will not see down in Southern California. And the last two that you see on this slide, Sharp Medical, Medicare Advantage, and Western Health Advantage, these are not plans that you will see down here in Southern California. However, you will see them on the CalPERS website because they are available through CalPERS, but they are available in the Northern California region. So just know that that's another thing too, is that based off of what area you are in, some plans like these last two may not be available. Your larger plans like Anthem Blue Cross, Blue Shield, Kaiser Permanente, your PERS plans, those are usually available because those are heavy hitters in terms of network. So you really don't have a lot to worry about those types of plans being available. The PERS Gold and Platinum are actually administered by Anthem Blue Cross. So these will be plans that are going to be available all up and down the coast of California. But just know that, you know, the plan options could vary based off of where you retire, okay? And this will never be last minute information. Again, this will be provided during open enrollment the year before it takes place. So mid-September to mid-October, you're going to find out what the plan options are going to be for Medicare eligible plans. You're going to find that out this year for what they're going to be next year, okay? So no last minute information here. So here's the CalPERS website. So I mentioned to you, oh, you can go on over to the CalPERS website and find that information. I wanted to visibly show you where you would be able to see this information. So if you go to the CalPERS website, they have 3 tabs across the top. And if you're looking at retiring, you want to select the retirees and health and Medicare. And so this is where you're going to find that information. They also, you typically have links for exploring resources for open enrollment. So they'll have information around Medicare and the retiree plans and rates, etc. So there'll be a lot of information there for you from a retiree standpoint. And here is the website link. All of this information will be provided in the presentation deck that will be available. This recording will be available for you to view. The slides will be available for you to view after this workshop as well. Okay, so before we get into vision and dental, I just wanted to do a quick look here in the chat box and see if there are any questions. I think I just answered one question, is if we'll be sharing this PowerPoint presentation after the workshop. The answer to that is yes. The next question I see in here is I have Anthem Blue Cross. It will go to PPO. If you are talking about if it will go to PPO for Medicare plan, for Medicare Advantage, for 2024, that's what it is for 2024. Okay, so that doesn't mean though that's what it will be in 2025. We're not in the actual open enrollment time frame right now. And because we're not in the, because we're not in the open enrollment time frame, we don't know what 2025 is. But in answer to your question, there's an Anthem Blue Cross Medicare Preferred PPO, and that's a Medicare Advantage plan. We'll talk a lot about that in the Medicare one-on-one workshop, so please make sure you come to that so we can explain differences to you. But then there's also the PERS Gold and Platinum plan, which are PPO supplements. They're also Medicare eligible type of plan options, a little bit different in terms of how they utilize Medicare. But again, that's a question for our Medicare one-on-one workshop. But yes, in answer to your question, for 2024, the Anthem plan will go to a PPO. Okay. All righty. Anybody have any questions before we get into dental and vision? Because we are not too far off from being close to the end of our content, but want to do a quick check-in with you guys. Any questions? All right, let's go ahead and move into dental and vision real quick so that you can understand that. So also a part of your retirement health benefits through Montebello Unified School District, you can continue with your dental and vision benefits. As it stands, as an active employee, dental and vision premiums are covered by the district. However, when you retire, you actually take on the cost of your own dental and vision benefits. Now they do have dental and vision benefits built into a few of the CalPERS Medicare type plans. I cannot speak to those plans. I don't know if they are as comprehensive. It's my understanding from some retirees that they are not. But what I would say to you is that the dental plans that the district have are very robust and rich. And so I would encourage you to at least stay enrolled into it in your dental and vision plans that you have through the district. And you can always do your research on the plans that may be available through CalPERS before you make any type of decision to drop your dental and vision that is available to you through the district. As I mentioned before, when you retire, you do take on the cost of your dental and vision benefits. And what will generally happen, or what will specifically happen, I should say, is part of your benefits packet, they do have an automatic withdrawal form where you put your banking information to let them know how you want your dental and vision premiums to be deducted, which account you want them to be deducted from. And so this is important that you fill that out if you plan on maintaining your dental and vision benefits. The thing I want you all to know is you can't decide that you don't want them right when you retire and then decide you want them later. You do have to maintain continuous purchase, deductions for your dental and vision. And if you start off with having your benefits, your premiums deducted, and for whatever reason you change banking information or there's a problem with your bank account, if you miss a payment, then and your coverage lapses, then you could be in danger of not having those benefits come back. So there's no, this month I decide I don't want them, next month I want them, then the following month I don't. It has to be continuous. So what I want to mention to you about your vision benefits, those are going to maintain through VSP as you're familiar with. And typically the deductions are withdrawn between the 1st and 15th of the month. And then for the current year, the rates are 14 for single, 27 for two party, and 37.50 for family. If the rates are going to be any different, it will actually be on that letter that Laura mentioned is posted for retirees on the benefits webpage. Okay, so that information with the new rates for dental and vision will be posted there. For dental, I want to mention you do have two options. There are MetLife options. There's a dental PPO and a dental HMO. There also the deductions for that are deducted between the 1st and the 15th. And I want to make sure you understand the dental PPO is a richer plan, so therefore it's a bit more expensive. You really don't have a lot of restrictions in terms of which dentist you can go to. It's always going to be a better option to go to dentists who are within the MetLife dental PPO network, just because those dentists have agreed to accept a certain price for your services. Whereas if you go see a dentist outside of the MetLife network, you will still be able to utilize your benefit, but that dentist hasn't necessarily agreed to the MetLife contract prices for services like cleanings or whatever your services are. So it is more comprehensive, but you do have a cheaper option as a retiree, and that would be the dental HMO option. It is more restrictive. You do have to make sure that you select your dentist before you go see them. You can't just, open up your Rolodex of dentists and say, I'm going to go see this one. If you have the DHMO plan, you have to actually contact MetLife, establish your dentist, make sure they're accepting new patients, and then, you can set your appointments from there. And some of the services are a little bit more restrictive than the services with the dental PPO, but then there are some that come already covered, and so you have to really see which one fits your needs. And you can see a significant difference in the price. Single two-party family for DHMO, $24.30, $46.17, and $64.40. So those are your options. You've got 2 dental options and 1 vision option as a retiree. Again, that's something you would pay for out of pocket once you retire. I mentioned this before, but a couple of tips, especially if you're about to retire very soon. When you're doing the dental PPO, which is the more expensive option, no prior provider selections required. You just really want to check to see if your dentist is, if the dentist you want to see is accepting new patients. You can ask if they're a MetLife contracted network provider. That's a good question to ask, because you'll know whether or not they accept certain, the MetLife contract rate for your services. And you can contact MetLife if you're looking for a list of dentists who are in network, or you can go on the MetLife website, and that information will be provided here. I mentioned just a minute ago, if you're looking at the DHMO, you do have to pick your provider first. So you want to go onto the MetLife website or give them a call. And then once you have established your dentist, then you can schedule care with your dentist. Now, I want to make sure I am very clear on this. The DHMO plan is really for California residents only, okay? So just make sure you know that. It is a cheaper option, but it is only if you reside in the state of California, okay? I mentioned this already. Confirm that your dentist is accepting new patients before you see them. Use in-network providers if you can. That will help you reduce your costs. And if you see a provider and there's an issue with your benefits, then you want to give the MetLife number a call. I have listed for both DHMO and dental PPO, and get them to fax over your dentist verification of coverage. I would try it if I were you. If you have any problems, don't leave the dental office. This is even if you're active. Don't leave the office if you're having problems. If they say, oh, we don't sure you have coverage, have MetLife fax over verification of coverage, okay? Give them a call. Okay, so any questions on dental and vision before I move on to the last quick part of the benefits? See if there's anything in the chat box. Don't see anything. Okay, all right. So let's move on. So talking about other benefits that are available to you, there are life insurance and long-term care. Right now, you guys have that as built in as part of your active employee benefits. You can continue to have life insurance and long-term care. You would want to go directly through those carriers though. So the life insurance is Lincoln Financial, but you would go through CISC directly, which is Self-Insured Schools of California. The contact information for this is available on the benefits website now. I believe I also have that in this presentation in terms of important contacts. And if long-term care is something that you are interested in, you want to contact Unum. It's usually, the contact is Harris Kivitz, and that information is on the benefits webpage as well, I believe, as I have in the important contacts section of this presentation. Okay, so that concludes the benefits that are available to you from a health, dental, vision perspective once you retire. I wanted to just take 2 seconds here, well, maybe not 2 seconds, maybe more like 2 minutes, to give you an intro to some information I think is important, especially if you are looking to retire or you are approaching 65. I think that, some basic general Medicare information here, not a lot, but we will cover it in detail at the Medicare 101 workshop. For those of you who are completely unfamiliar with what Medicare is, I want to be clear that Medicare is a federally funded health insurance program, which includes Part A and Part B. Many of you may have heard it referred to as Original Medicare. If you want to continue to participate in the CalPERS health plans, you are required to enroll in Medicare Part A and B. This is not something that is mandated by the school district. That is something that, number one, it is a federal, for those who plan to take advantage of any type of Medicare, it is a federal requirement that you do enroll. And if you don't enroll, you decide to enroll later, you could incur penalties. So you don't want to do that. But aside from that fact, in order to utilize your CalPERS health benefits, you have to enroll in Medicare A and B. And it's Social Security Administration who determines eligibility. And Medicare is administered by the Centers for Medicare and Medicaid Services. You've probably heard it referred to as CMMS or CMS. So that's in a nutshell what Medicare is. I mentioned before, once you retire, CalPERS doesn't require you to enroll in one of the Medicare eligible plans once you become eligible. And here's what I've gotten this question before. Well, what if I am retiring and become Medicare eligible outside of open enrollment? Do I have to wait? No, you don't have to wait. If let's just say you become Medicare eligible and you are retiring in, say, November, you don't need to wait again until the next open enrollment. You would actually go through the process right then. You would select your plan then. So you'd be able to enroll then. And then you don't need to enroll in Medicare if you continue to be an active employee. That's another question we get. And if you have more detailed questions on that, I'm going to encourage you to attend the May Medicare one-on-one workshop. We talk about that in detail. We have a lot of people ask those questions. We answer all those specific questions. So make sure that you attend that workshop. And then the last important fact is if a retiree or their dependent dies, then the retiree or the retiree's executor is responsible for notifying CalPERS, so that the changes can be made accordingly. Okay. Nora, you had a question.
Yes. Going back to this Medicare, because I was confused and I did speak with Laura. I did go to Social Security and I am still active. I'm 65, but active. So they basically made me go enroll into Part A only, the hospital portion.
Mm-hmm.
But as you said, until I am ready to retire, then I have to enroll in Part B.
Correct.
Okay.
Yes.
That was it.
Okay.
That's my question. Thank you.
No problem. So just some quick important contacts. CalPERS, we have the telephone number. They're open Monday through Friday, 8 to 5. I have the telephone number for HR benefits. And if you have questions, Coast is in here, listed in here. Coast is who is the payment administrator for your vision and for the vision and dental once you are retired. They are the ones who are responsible for deducting the actual premiums from your account. I also have listed on here Social Security, Medicare, and I have my contact information on here. I understand this is a lot of information and likely you will not absorb everything. And so you may have more questions. And so we'll want to encourage you to, number one, your number one contact is always going to be Laura Simmons in your benefits department. She's a fantastic resource. She's the person to go to. But if you have questions that require assistance with kind of helping you determine what options might be viable for you from a plan standpoint, or you have some issues from a patient advocacy standpoint, or you want to bounce some questions off of me regarding, what you might consider from a plan standpoint in Medicare, please feel free to reach out to me. And my telephone number and email address is listed in the contact section of this presentation. And then all of the other information I mentioned to you before from the other benefits that you have, dental, vision, Unum, CISC for the life insurance. And then this is the employee contacts document that is listed on the benefits page. If you guys have not gone up to the benefits page in a while, you should check it out. Laura and the benefits department have been updating a lot of information. So there's a lot of good info there. So please make sure you check that page out. I mentioned May 16th is the Medicare 101 workshop. That is for the spring, okay? It will be virtually. We will be recording it. And it will be good information. If you cannot make the May one, we do have November 7th. That'll be the fall one. This will be the first year that we're doing 2 in the year. So if you can't make the May one, or you want to do, double time with Medicare information, you can attend both. All right, so I wanted to turn it over to Laura. Before we go on to your questions, I wanted to turn it over to Laura real quick to allow her to talk about some content that she feels like you guys need to know as well.
Hi, I just wanted to let you know that for some of you who either haven't been here that long, or who are perhaps just 4 or 6 hour employees, it's possible that your retirement check is not going to cover your medical premium. And when that happens, CalPERS is going to put you on direct bill, and they're going to require you to pay 3 months in advance. That's just what they do, and we can't do anything to not make them do that. That's what they're going to do. We, however, are going to reimburse you based on the CalPERS bill, which means we're only going to reimburse you 1 month at a time. So you need to be prepared for that if your retirement check is not going to cover your medical premium. Okay. And that's it.